Hi, I'm Dr. Cary Goldstein. I'm the founder of the Goldstein Dental Center here in Atlanta, Georgia. We're now going to take our coarse diamond to remove the facial surface, and we're going to use it to put depth cuts onto the occlusal surface to make sure that we have plenty of room for ceramic. So I'll show you what we mean. We're going to start with the occlusal, putting about a 0.5 millimeter depth cut on both sides. Now we're just going to connect those and try and go along with the surface of the tooth. We don't need to flatten it. We want to go with the grooves that are there and the anatomy of the tooth that's there. So since you're just doing this surface, you should start to see a channel right in the central groove right here. Now we're going to go to the lingual surface and remove that about 0.5 millimeters. You can remember that ceramic does great in compression, so on the chewing aspect of here, we rarely, if ever, see these things break. We're going to come over to the facial surface now and just go right with our depth cut into the depth of our depth cut. Make sure you go interproximally enough to hide any teeth structure that's there. Once again, we're on the supergingival because we're on the lower. Very few people show the gum tissue on the lower. So why go subgingivally if you don't have to? It makes your impression so much easier. We're going to now bevel that occlusal to facial surface. At about a 45-degree angle. Round that out. Okay.